Welcome to your 4state.com's Medical Corner. I'm Sajata Khandelwal. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you, Dr. Michaels.
Thank you for having me.
Our first question for you, what is Achilles tendonitis?
Well, Achilles tendonitis is inflammation or pain in the Achilles tendon. And the Achilles tendon is on the back of the heel. Here's a foot model. And the Achilles tendon would come down and attach to the central aspect of the back of the heel. And when it gets inflamed, it causes pain. Now, there's a lot of different things that could be called Achilles tendonitis, and there's different names for all of these things. A tendinopathy, Haglund's deformity, calcific tendinopathy. But bottom line, it hurts back here in the back of the heel. Not on the bottom, but the back, okay? And that's where the Achilles tendon attaches. So when something hurts back here, there's several easy ways to treat this, and there's some surgical ways to treat this too. But inflammation or a bone spur back here can cause it. And the Achilles tendon is the strongest tendon in the body, and it attaches right here. And it's very important tendon for propulsion and walking.
And how do you treat Achilles tendonitis?
Well, because the Achilles tendon attaches to the back of the heel and it pulls up, there's a lot of pressure back here, and sometimes a spur can form, but the bone spur doesn't cause any pain. So it's just a sign that there's inflammation or degeneration in the tendon. So if you take the pressure off that tendon, the pain will go away. So bottom line, lift up the heel. Okay, so this is one condition where wearing a little bit of a heel may help, or wearing a running shoe with a thick sole on the heel will help. Or a felt heel lift, like a 1/4-inch lift will help. But if you do a heel lift, you have to do it on both sides because you don't want to create a limb length discrepancy. That's really the main treatment for Achilles tendinopathy. A heel lift initially, then possibly followed up by a custom orthotic device with a lift built into it. If pain persists, sometimes alcohol shots are put back here. It's like a 40% alcohol solution, half a cc, and it just goes back there and it deadens the pain. And what you care about is getting rid of your pain. If those don't work, which they usually do, then sometimes surgical intervention is necessary. You want to try to avoid surgery in this area if possible. But if you're still having pain after all the conservative treatment is over with, then surgery may be an option. So bottom line, when you have Achilles tendinopathy, wearing a little bit of a heel can help, and a heel lift is very effective in relieving the pain of Achilles tendinopathy.
Thank you, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. And don't forget, you can find more information on foot and ankle conditions only here on your 4state.com.